Hi, Nursing 6818, Dr. Kim Paxton. We're into module number 5. This week's content will be related to literacy and health education. Your objectives this week are to take what you have learned in the past in relationship to patient and client education and now begin to translate that into a higher level of thinking and application as a nurse practitioner. Health literacy from a nurse practicing perspective isn't just what patients read, it's how they interpret words, it's how they understand visual cues, whether it is in words or it's in pictures. It is how they utilize technology and apps and technological devices such as glucose meters and weight monitoring devices, SaO2 monitors, blood pressure cuffs. It's all of these elements, and are they able to understand how they work, how they integrate, and how you as the nurse practitioner need to help them understand these elements as part of their health gaining goals and plans. I'm also going to ask you to be able to differentiate the different types of health literacy. So we have our visuals, we've got our actual literary components of words, we have auditory components, we have the technological components, we have tactile components. There are a lot of different literacy types that come into play in educating a patient. And as a nurse practitioner, I need to be able to understand how a patient may have limits and then how can I help them overcome those barriers. That leads us into number 3, strategies. How can you implement strategies to help a client address the literacy level deficits that they have and help them overcome them? So in order for you to be able to do that, you have to understand how people don't understand things and then how to engage in trying or using them or moving beyond a set of knowing knowledge to something they may not know and giving it a try. So this week you've got several types of readings to help support you being able to obtain these objectives and actually begin to form a stronger foundation from a nurse practitioner perspective. You've got your readings in Edelman. In chapter 10, I'm asking you to specifically look at some strategies that actually help to promote health literacy. The Hirsch article is really good at helping you understand how do you take all these elements and realistically look at them for application in a primary care practice. I provided you with the CDC guide in relationship to what is considered health literacy. So take a look at all of these. Please make sure you're gaining some understanding and push yourself beyond what you know. You know how to educate patients, you do it right now, but you have to take it to a different level as a nurse practitioner. You have to be able to come up with plans of education that actually motivate the client to change, to engage in, to do treatment, to do intervention differently than you do in a hospital setting, because in this setting, you are going to be responsible for the outcome related to that client's plan. That leads us into motivational interviewing. I'm asking you to please read over an article by Rolnick, Miller, and Butler. There's actually a book written by them related to motivational interviewing. I didn't want to add more cost to your books for this course, so I'm going to have you look at the article that actually set off the writing of that particular book. In this article, the different chapters actually relate to what is written in the article. So the article gives you the elements or the skill sets associated with motivational interviewing and helps you understand what those are. There is a really great slide presentation. It doesn't have overlay recording to it, so you'll just need to read through it, by the University of Minnesota related to motivational interviewing. This particular slide set takes each of the skill sets associated with motivational interviewing and breaks it down into what it looks like and what would be involved in that component of it. So these two together should really help expand your current knowledge base of what motivational interviewing is and take it to that higher level that you will apply it at the nurse practitioner level. I provided you with a couple of different supplemental reading elements. The Steps to Shared Decision Making is a really good article. or actually a website with different bullet points by ARAC. It actually helps you understand how to do shared decision making, and it ties back into the motivational interviewing. I have a couple of different videos for you this week. Both of these videos that you have in the beginning, the ineffective physician and the effective physician, show what it looks like just to interview a patient, but not to try to motivate them to really do change. And the second one, the effective physician, actually is using the motivational interviewing skills and applying them to motivate the client for change. There is a third video, and it just shows this being applied to a teen subject. This week you have a couple assignments. One of the first assignments that you're going to be doing is a video recording of you interviewing a patient, which is going to be your actor. So for this particular assignment, you're being asked to do a video recording of 3 to 5 minutes based on a scenario. And in that scenario, which I'll show you one of them in just a second, you are going to try to motivate the client to think about changing. Now, you're going to choose someone from your life. It could be a family member, a friend, it could be a peer. I've had people use their children before. And you're going to pick a situation, either from the scenario or one that you make up, in which you want to help that person understand to change and try to get them to at least consent to trying something, and then have them state back what it is they'll try. You're going to be employing the motivational interviewing skills in this video. Now, some of you may not know how to do video recordings, but everybody knows how to use a cell phone and take pictures off your cell phone. Your cell phone can be used, and you can upload that video to your computer and then transfer it over as a file into Canvas as your uploaded document. I've had people record their video and then upload it to YouTube and then transfer the URL over for the YouTube as their assignment upload. Canvas does have a recording element that you can use. It's a little bit more difficult to use, but you most certainly can use that if you want. The other element to this motivational interviews, you're going to write a reflection paper, and I'll go over that in just a second. So for this assignment and the video recording, whoever you choose to help you, they're going to be your actor or your actress. Now let's go over one of their scripts. Now the script that you're going to be using, or the scenario, can be one of the four that are embedded in the actual assignment. And the top part of it is the situation in which the actor or actress is involved with. So you have this understanding, and your actor or actress has this understanding. You're going to use motivational interviewing skills to help them understand and see why they should possibly make a change with one of the unhealthy situations that are occurring in this scenario. Now, there are several, and it's impossible to address all of these in 3 to 5 minutes. So choose wisely and choose maybe one or two. And then what you're thinking about as you're doing this is that in a real clinic situation, you only have maybe 15 minutes with this patient. So you need to choose your best bang for your buck, if you will, and go after that key element. It is totally appropriate to say, when you come back at your next visit, I would like to discuss, and then choose some of the other elements or another element that you didn't get to discuss, and you want to do that as your next visit with them. So you want to choose an element from this scenario in which you can help them understand that there could be a change, how you're going to go about doing it. So your motivational interviewing skills are going to come into play here, and you're going to be using them to actually make this change. So that's going to be the video that you're going to be recording. Inside of Canvas, if you have any problems with how to record a video or how to upload a video, in your left-hand toolbar, there is a Canvas Help tab. Click on that tab, go to Canvas Guides, and choose the student one, and then look at how to upload a video or how to record a video in Canvas, and it'll help you. If you have any questions or any problems with this assignment, please make sure you're contacting me. I can help you through it. The next element is the motivational interviewing self-reflection paper. And this one is a paper that is 1 to 2 pages, no longer than that. There is no reference page. You do need a title page. And you're going to be addressing the elements that you engaged in your motivational interviewing recording. So the first thing I'm going to ask you to talk about and reflect upon is the actual experience of using the motivational interviewing skills with your actor. And what I need you to do is reflect upon what happened and how hard was it and what did you actually get from this process. I know that this is a false environment that you're doing this in, but be open to the process and understanding the process and how you would apply it differently as a nurse practitioner than you would as a nurse, because it is different. And then what are you seeing and how is it different, and why is it harder to do this as a nurse practitioner than it is as a nurse? Come forward with some of those elements. How hard was it? The next piece is identifying your strengths. So, of the skills that you were using, what do you think you really did well? And what do you think is some element of the skill set that you're going to need some time to learn? And tell me why. Are there other interviewing techniques that you could have employed along with this that you may have used as a nurse that you can roll over actually into this new role as a nurse practitioner? If you choose to use some references, that's fine. But I'm not asking for a reference page. But I am asking for headings, so each of these elements that are your questions would come under their specific heading. Please also number your pages. Do not go over the 2-page limit. The title page is not included in your page count. Any problems or questions with this particular assignment, please make sure you're asking me. This is written in the first person, so use the I. The rubric is quite simple for this assignment. It is speaking exactly as I've explained the assignment to you. So make sure you review it as you're writing your assignment. The next piece you're going to be working on is your CLT discussion. Now there are two main components to this discussion. The first component is a scenario. What I'm asking you to do is read over this scenario, and then as a nurse practitioner, how are you going to get that accurate information from this patient? I've given you 6 different types of interventions that you can use to help obtain this information, and I'm asking you to choose one or more of how you would go about obtaining this information from Mrs. Tom. And then I'm asking you to support what you're saying. So here's an example. If I write this like this, I'm going to assist obtaining an accurate information from Mrs. Tom by I'll establish some timeline of events with her. I'll ask for clarification from a family member, and I'm going to obtain medical records from a prior provider to help me understand her history. Okay, that's good, but why? Why are you going to establish a timeline of events? What's your rationale for doing that? How is that going to actually lead into getting an accurate history? Why would you even seek the information coming from a family member? Maybe it's going to be skewed. I need to understand the rationale of why you're going to do that and how it can actually help promote obtaining that accurate health history. And not just your words. I really would prefer it if you went ahead and strengthened this by a citation that tells me that according to the literature, this really does it because of this way. So make sure that you're doing that. The second part is an article that is a brand new article that was just very recently published within the last month. It's a controversial article, so some of the information within this article may grate on people in an not abusive, but in a negative way. Because of that, I'm asking you guys to check emotion as you answer the question, engage in high emotional intelligence in your answer, and remember that your response may not be the same response as another individual's, and you may not agree with it, but it's another person's right to write what they feel and believe. When you're responding to somebody who has a response that is not of your agreement, make sure that you're professionally responding to that. Take away the emotion of the moment and just write the facts of what your belief is. I don't want to see unprofessional communication occurring in this discussion because it can get controversial. So that happens in our real world as nurses. As nurse practitioners, it's going to happen even more because we're engaging with a lot of care providers that may not agree with one, our role, and number two, my way of employing care to a patient. So this gives us an opportunity to engage in that. So the first question I'm asking you to answer is, do you agree with what the author is saying? Make sure you're explaining your response and why you agree or disagree. The next question is, have you experienced what this author is talking about with a patient, family, friends, or even yourself? And then tell me the situation in which it occurred in. And if what is written in this article is really occurring, what is the potential impact to you as a nurse practitioner in educating patients? What's going to happen? What do you need to do? How do you need to address this? I'll bring that forward. I'm looking forward to seeing your responses to this. I typically stay out of your CLT discussions and monitor them, but don't engage so I don't disrupt the conversation flow and the learning based upon my views, but guide you guys through it. For this particular discussion, I will be coming into the discussion and doing comments intermittently in each of the different CLTs. So you'll see me in there this week doing that. Enjoy this article. It was really quite an eye-opener when I read it. I hope it is for you too. I'm going to leave you with this thought. Books are no more threatened by Kindle than stairs by elevators. As you go through this final article that I'm asking you to read, I believe that you'll understand why I've put this quote here. Have a great week. If you have any questions, make sure you're contacting me. You're doing a great job. I'm looking forward to reading all of your papers that you've just submitted related to risk and assessment. See you online virtually.